welcome to the deep dive. Today, we're really pulling back the curtain on something we all experience, but maybe don't fully grasp at the cellular level. Acute inflammation. Think about getting a splinter or maybe twisting an ankle. Instantly, you see that redness, feel the heat, the swelling, the pain, what's actually happening under the skin. And that's what we're exploring today, the body's immediate vascular reactions.
Yeah, our mission here is to give you a real shortcut, not just definitions, but a feel for the incredible choreography your body performs when it's under attack or healing. By the end, you should have a totally new perspective on those first critical moments of defense.
Absolutely. And the sources we're drawing on, they lay out a really detailed map. We're going to trace everything from those very first tiny shifts in blood flow all the way to how immune cells actually move out into the tissues. It's like looking at the body's emergency response system, piece by piece.
Okay, so let's kick this off. Acute inflammation. We're talking about the body's immediate, right away response to injury or infection, right? The first alarm. Exactly. The very first response. And it really boils down to three core components. First, you get vasodilation. Basically, the blood vessels widen, increasing blood flow to that specific area. Think of it like opening up the highways. Second, increased vascular permeability. This means the blood vessels become, leakier. They let plasma proteins and, crucially, immune cells, the leukocytes, escape the bloodstream into the tissue. And third, leukocyte emigration. That's the movement of these immune cells. They travel to the site, pile up, and then get activated to do their job.
And what actually flips the switch? What starts this whole cascade?
Well, typically it's things like microbes, bacteria, viruses invading, or it could be necrotic cells, cells that have died from an injury. These act as danger signals. They activate phagocytes, a type of immune cell, and these phagocytes then release a whole bunch of chemical signals, cytokines, and other mediators. It's like they're shouting, "Problem here," and sending up flares.
Okay, so that makes sense. It's a triggered response.
Right. And the whole point of these vascular changes, the big picture strategy, it's simply to get those essential defense mediators, the proteins and the leukocytes we mentioned, to the exact spot they're needed fast. It's the body rushing its emergency team right to the scene. Pretty clever, actually.
Definitely. Now, as we get deeper into this, we'll be using some specific terms. They might sound a bit technical at first, but really understanding them is the key to differentiating what's going on.
Absolutely. Let's nail these down. First, exudate. This is fluid that leaks out, and it has a high protein content. It often contains bits of cells, debris. Crucially, if you see exudate, it strongly implies inflammation is happening. Then there's transudate. This fluid has low protein content, very few cells, if any. It's usually caused by pressure imbalances, like hydrostatic or osmotic pressure, not directly by inflammation itself.
Okay, so exudate means inflammation, transudate means pressure issues. What about edema?
Good question. Edema is just the general term for excess fluid building up in tissues or body cavities. And importantly, that edema fluid could be an exudate or it could be a transudate. Edema is just the swelling itself.
Gotcha. And the last one, pus.
Ah, yes, pus. That's a specific type of exudate. It's what we call a purulent exudate. It's thick with neutrophils, a type of leukocyte, plus dead cells, and often the microbes that caused the infection in the first place.
Right. So things like the stuff from an infected cut, that's pus, a type of exudate. Or maybe just general puffiness after a bug bite, that's edema. Could be exudate too. We're kind of adding the Y behind these things we see all the time.
Exactly. Putting the science behind the everyday experience.
Okay, so let's connect these microscopic events to what we actually see and feel. You mentioned vasodilation first, that increased blood flow driven by chemicals like histamine, right? That's the direct redness and warmth.
Precisely. Histamine is a key player early on. It makes those vessels relax and widen, flushing the area with blood, hence red and hot. And at the same time, that increased permeability we talked about lets fluid, rich in protein, escape the vessels into the surrounding tissue.
Which causes swelling, the edema.
Right, but here's a really interesting consequence. As fluid leaves the vessels, and the vessels are wider, the blood flow actually slows down. It gets sluggish. This is called stasis. The red blood cells get more concentrated, the vessels get congested, kind of like a traffic jam. And this stasis, this congestion, also really contributes to the redness and warmth you see.
So it's not just faster flow making it red, it's also slower, backed up flow. That's counterintuitive.
It is a bit, but it's crucial. Slowing the flow helps those leukocytes stick to the vessel walls and get out where they need to be.
Okay, that makes sense. So if the vessels get leaky, how does that happen? Is it just one mechanism, or are there different ways they spring a leak?
Oh, it's definitely not just one way. There are a few main mechanisms for this increased permeability. The most common one is endothelial cell contraction. The cells lining the blood vessel, the endothelial cells, they actually pull apart slightly. This is usually triggered by mediators like histamine, bradykinin, leukotrienes, stuff like that. It happens fast, within maybe 15 to 30 minutes, and it's usually short-lived. We call this the immediate transient response.
Okay, quick gaps opening up. What else?
Then you can have direct endothelial injury. This happens in more severe situations. Think bad burns, nasty infections, maybe exposure to certain toxins. Here, the endothelial cells themselves are damaged or killed. This causes leakage that starts immediately but is sustained. It lasts much longer.
Wow. Okay, so direct damage means longer leaking.
Right. And there's a third type called delayed prolonged leakage. This one's a bit weird. It starts later, maybe 2 to 12 hours after the initial injury, and can last for hours or even days. The classic example, a bad sunburn. The worst of the swelling and blistering often comes hours later. The exact mechanism is still debated for this one.
That's fascinating. So a bee sting might be that immediate transient thing.
Probably, yes.
But a serious kitchen burn or that delayed sunburn swelling, those involve different, longer-lasting leakage mechanisms.
Exactly. The body kind of tailors the leakiness based on the type and severity of the insult.
Which brings us back to those fluid types. Exudate versus transudate. You said the difference is key.
It really is, especially clinically. Let's recap the comparison. Protein content. High in exudate, low in transudate. Simple as that. Cells. Exudates usually have white blood cells, maybe red blood cells. Transudates are basically cell-free. And the underlying cause. Exudate points to inflammation, that increased permeability we've been discussing. Transudate points to pressure problems, hydrostatic or osmotic.
Give us some examples again.
Sure. Think pus from an abscess or fluid buildup in the lungs during pneumonia. Those are exudates. Swelling in the legs due to heart failure or liver disease causing fluid in the abdomen, that's typically transudate.
So for a doctor, figuring out if fluid is exudate or transudate is a huge clue, isn't it?
Absolutely pivotal. It helps determine if the problem is inflammation, infection, or something else entirely, like organ dysfunction. It guides the whole diagnostic path.
Okay, you mentioned endothelial injury causing sustained leakage. Besides burns and toxins, you said infections too.
Yes, some severe infections can directly damage the endothelium, but here's something really striking. Sometimes during intense inflammation, our own neutrophils, the immune cells rushing to help, can actually stick to the endothelium and inadvertently damage it as they try to get through or release their contents.
Wow. So our own defenses can cause collateral damage.
They absolutely can. It highlights this really delicate balance in inflammation. It's protective, but it can also be destructive. And leakage from this kind of injury, whether from toxins or neutrophils, basically continues until the vessel is either plugged by a clot or repaired.
And the consequences of that sustained leakage can be really serious, right? You mentioned fluid loss.
Extremely serious. In cases like major burns covering a large area of the body, the amount of plasma lost into the tissues can be massive. It can lead to shock, basically life-threatening fluid depletion. Managing that fluid loss is critical.
Okay, this is intense. Let's shift gears slightly. What about the lymphatic system? We always focus on blood vessels, but lymphatics must play a role here too.
A huge role, often overlooked, like you said, but absolutely vital. They're the drainage system. Lymphatics normally collect excess fluid, cellular debris, even microbes from the tissues, and return it eventually to the blood. Now, during inflammation, with all that extra fluid leaking out, lymph flow increases dramatically, sometimes tenfold or more. And not only that, the lymphatic vessels themselves actually proliferate, they grow to handle this increased load.
So the drainage system ramps up significantly.
It does, but sometimes it gets overwhelmed, or the lymphatics themselves get inflamed. That leads to lymphangitis, inflammation of the lymphatic vessels, or lymphadenitis, inflammation of the downstream lymph nodes, which get swollen and tender as they filter all that inflammatory material. Swollen glands.
Ah, okay. And you sometimes see signs of this, right? Like red streaks.
Exactly. Those red streaks you might see on the skin leading away from an infected wound, that's often lymphangitis. It's a visible sign the lymphatic vessels are inflamed.
That's pretty amazing, seeing your body's internal plumbing light up like that while it's fighting something off. A real visual clue.
It really is. Now, let's circle back quickly to that stasis, the slowed blood flow. We said it helps leukocytes get out. How? Well, the slowness allows these cells, mainly neutrophils at first, to fall out of the central stream of flow and kind of tumble along the edges. This is called margination. At the same time, the endothelial cells lining the vessel become activated by the inflammatory signals. They start expressing adhesion molecules on their surface. Think of them like molecular Velcro.
Sticky patches for the immune cells.
Pretty much. The leukocytes weakly stick, roll along the surface, then adhere more firmly. And finally, they actively squeeze through the gaps between endothelial cells and migrate out into the tissue, following the chemical trail towards the injury or microbes.
So margination, rolling, adhesion, migration, a whole sequence.
A very precise sequence. And this whole process is what delivers the leukocytes to the battlefield. It sets the stage for the next crucial steps. Phagocytosis, engulfing the microbes or debris and killing the invaders. That's the ultimate goal here.
Okay, let's try and pull this all together then. What's the big picture takeaway for someone listening? We've seen vasodilation causes redness and warmth. Increased permeability leads to edema, the swelling, and that protein-rich exudate. We know leakage happens through different ways: fast contraction, slower injury, even delayed responses. And the lymphatic system is working overtime in the background, draining the mess, sometimes getting inflamed itself. So really, those classic signs of inflammation, redness, heat, swelling, pain, they all boil down to these vascular changes, fluid leaking out, and immune cells piling in.
That's a great summary. It's all about getting fluid and cells to the site of trouble. And maybe here's a final thought to consider. We've talked about inflammation being essential, right? For healing, fighting infection. But we've also seen how intense it is, how our own immune cells can damage our tissues, how fluid loss can be dangerous. How does knowing that depth, that potential for self-damage, even within a protective process, change how you think about something as common as, say, swelling around a paper cut, or the incredibly complex, sometimes damaging process of recovering from a severe injury like a burn? It really drives home that inflammation, this fundamental defense, is an incredibly powerful and potentially double-edged sword. It's a constant balancing act within the body.